bring this up here. So this lady, Janet. So I just want you to sort of imagine if you were seeing this patient for the first time. And so this is her mouth here. You can see this is the lower arch there. I can see you all on here quite nicely. So just give us a thumbs up if you can see that photo. Good, that's great. So, so I'm going to design a denture to fit around here. But before I do, let's just have a little look. What I want to know is what's happening underneath the surface. So I do some X-ray pictures of these teeth there. And, you know, it's like, if I think we've got sort of teeth with dubious prognosis, and to a certain extent, these teeth do have, you know, that tooth at the back there with the crown on isn't fantastic. It's got, you know, deep pocketing. These anterior teeth, again, they're not too bad. You know, you've probably got about 70% bone. Is that right, Saeed? Would you say that? We've got quite a bit of,
yeah, I agree.
you know, maybe more, about 45% of bone on here. So, but anyway, so they're not in fantastic condition, those teeth. But immediately, do you know what I thought? This tooth here is not great. It's been root filled. It's got a decent root filling. So I thought for that patient there, I thought, let's just smooth that tooth down and just leave it as an overdenture abutment. That was my thoughts there. And also, this tooth here, this back tooth there is really useful for support, you know, for that patient there. So, but it's also got, you know, it's not in fantastic condition there, but it's still useful for supporting the tooth with, the actual denture with. So for instance, if I lost that back tooth in the future, then we can add to it. And I want to show you that in a minute, how we can do that, because I've got a case just like that. But anyway, I'm going to stop sharing my screen now. But what I want you to do just before I do that, just imprint on your mind what that looks like there. So we've got lower 2 to 2, 3, 4, and then this 8, which is in about the 7 region. So I'm going to stop sharing my screen now, and I'm going to just move that to there. And what I suggest is, if you can you see that there? This is my design sheet here. So I can see you there. Just put your thumbs up if you can see it okay, because I'm going to be drawing on that bit there. Brilliant. So first of all, what I do is and I've got the actual picture on the screen just next to us here. So that's the 8. It's really in the 7 position. So that's there. And what I do is I just color in the teeth that are missing and want to replace. And I do that in this sort of yellow color. So, and then color in, and then we've got the canine. So that's missing too. And what I'm thinking in my mind is how we're going to clasp this, what we're going to do, because I'm thinking 2 clasps per denture. Let's come round to here. We come round to that 3 there. That 4, I want to smooth down. So it's an overdenture abutment there. So it's going to be incorporated into the denture. And then I'm wanting to replace these teeth at the back there. Now, what's going through my head at the moment now is we've got, that's the natural tooth there that's present. I like to do symmetrical dentures quite often. So I'm going to replace that back tooth, that 7 as well, just there in the free end saddle position. So in this drawing here, this is our new design sheet here. I've got those 2 back teeth in like dots. So I'm just going to fill that in. So that's all of the teeth on here. And then next, I'm going to think about my supports. So I love on single molar teeth, they're fantastic. These ring rests like that there. So that's my support here. Now, these anterior teeth here, all of those have got reduced attachment. Their prognosis is guarded. Who knows how long they're going to last, really. So I want to put backings on those, all of those back teeth there, like that. That's what I think about straight away. And also, the other thing is, when I'm doing lower dentures here that have got teeth that are unrestored, I like to put composite rest seats on those there like that. So that's the composite rest seat, and it's got this little mountain top really, and the denture just fits on the back of those. And then I'm going to put backings on those teeth there. So join that up like that there. So that will be the metalwork will span all the way across here like that. And then what I'm going to do is I'm going to draw in the saddles now. So, and I want you to keep all the componentry away from the edges of the teeth. And I draw it on so that, can you see I've just taken it really tight up against that artificial tooth there. And we're going to take this all the way back here. And I'm wanting to extend it up the retromolar pad, about halfway up the retromolar pad. So I draw it on the back here. And then when I'm coming around to the front there, I bring my design, I don't bring it out so it's chunky, that bit just there. I want it tight up against that tooth there like that. So I'm going to draw this saddle too. So nice and tight up against the tooth here. It flares out a little bit as it comes away from into the middle of the saddle, and then it comes really tight back in around that tooth there. So there's no superfluous bit of pink just in that area. Just bringing that out like that, all the way around, just there like that. So they're my saddles, and it's almost now lending itself for the lingual bar to be drawn in that section, you know, the sublingual bar. So let's go for it with this. So that's the sublingual bar. We can bring that across here like that into that area, just like this. Now, in fact, you can draw it just a little bit wider, that there. So I'm going to color that in. So let's get all of that metalwork colored in. So we've got this ring rest on the back here like this. We've got this sublingual bar underneath here like that. And then all of this area here. So dental bar like that. And just to make it extra obvious for the technician, I draw in my composite rest seats there like that with that. So, and these are additive rest seats. And I just label what they are. So it's over two to the canine there like that. So that's that. Now I've got to think about the clasping, and my sort of rules for, you know, partial dentures are 2 clasps per partial, and generally in the lower, I like to have them in the middle of the denture, you know. So if you've got 2 premolars there that are present, I like to clasp those, because that's like the center of the denture. So you've got clasping in the middle, and you don't have clasping at one end or the other, because if you've got clasping at the far end, it often makes the denture want to tilt up like that, you know, because it's clasped by the back teeth. So if you've got clasp right on the back, it wants to tip up. Whereas in the upper, I want the clasp as far back as possible, out of sight. completely. So, but if we have a look at the front here, we've got this. I don't really like to clasp lateral incisors. So we've got this molar at the back there. So, and in these cases, when it's really tilted like this, which we'll have a look, I'll just show you it again. There, if you can just see that. There, this tooth is really quite tilted. So I'm going to just go to the side there. If you look at it there, it's tilted up. So we've got quite a mesial undercut in that area. So now putting a ring on it and a clasp, like a big chrome clasp coming off the side of it, then could really engage that undercut really heavily and really torque the tooth. So rather than doing that, I thought, let's have a little gold clasp just coming out of the flange of the denture instead. So do you know what I mean by the ring and the clasp coming off the side? Yeah, you'll have seen those on my designs where it comes off the side, the chrome clasp. But in this case, I thought, and I'm just going to stop sharing there so you can see this. We'll do a little gold one that comes across here into that area just there. And just, I love doing these drawings. I've got a little gold pen here, which I can then just colour that in just like that. And then it just looks really nice for the, technician. So we've got one clasp on this side, and then we've got another here. I'm going to put on that canine. Now, because that's this, we've underneath here is an overdenture abutment there. Now, when we've got an overdenture abutment there, it means that we've still got the alveolar bone, we've still got the gum tissue there, and it's really easy to make the flange fat in that area and thick and stick out, and it can push the lip out. It can be uncomfortable. Plus, if we have quite a bulky flange there, we can't have a bulky flange. It's just not right in these circumstances. So what I do in these situations is we have an occlusally approaching clasp coming round off the straight out of the flange. So normally I like to have gingerly approaching clasps coming up, but because we can't have that depth of flange there because of this overdenture abutment, then it needs to be a gingerly approaching clasp in that area. And I've opted to do a gold one there. Now, if the patient had, when they're talking, and had quite a bit of, they showed quite a lot of their lower teeth and they're just socializing and chatting, then I would put a white one on there, a tooth colored clasp, like a dental D clasp. But the only issue with dental Ds are that it's like, how long is that dental D going to last? And also, how long is it going to remain stain free as well? So if it's all possible, I'd prefer to use a metal one, like a gold one. So, and these are 0.9 millimeter for that thing there. So that's that. And then finally, the last little thing that I do is just using my, and these are Pro Marker actually pens. This is a cocktail pink for doing the acrylic work. So, and then just do that. And whilst I'm doing this, I can feel my blood pressure dropping and feeling nice and relaxed with a little bit of adult colouring in for a very good purpose. And actually, once I've done all this, I photograph it just with my iPhone, put it into the patient records, and also I can put it into their treatment plan letter as well. So it helps me. This is what I do. This is the first stage of writing my letters to my patient. You know, I plan the denture design first, so I know what we have to work towards, like that, and then I can then treatment plan and sequence the whole treatment. So that's for this patient here. So any questions about that just so far?
Is the model surveyed, Finn?
No, actually it isn't. I only survey it when I get into making it.
Right.
So I go with the photographs, X-ray pictures, and also my pre-treatment charting, you know, doing pocket probing depths, etc. So, and then when we actually come to do the first model, get the primary cast, that's when we put it on the surveyor, and then we can actually check whether that design is truly appropriate or not, or whether I need to put on, you know, for instance, do I need to put a little bit of composite on the outside of that canine just here to give it better retention on that clasp?
Yeah.
So, and then also sometimes I'll do a little bit of shaving of the mesial surface of a tooth that's tipped like that, but I didn't do for this case. I just left it as it is. I'll show you what I did first for her. So I'll just share my screen. So this lady had, she originally came just to see me for a full upper denture. So, but I'll show you the lower first, and then I can just chat with you about her. So that's the finished denture there. This has got a sublingual bar. Now, what I recommend is truly don't do sublingual bars. If you know, they've got a massive learning curve, and it's just, you can just get them so wrong. So I think using the lingual bar is sufficient. The sublingual bar, you can just tuck it further down out of the way and keep it further away from the gingival margins, but they are flipping technique sensitive, you know, with doing your impressions to get right under here, you know, underneath the tongue. So, and I've learned the hard way with these, you know, with Dr. B loves them, and so does Charlotte Stillwell. And it's taken me about 2 years to really nail it in terms of getting the patient to do this border molding with the tongue in the right way, and me to trim the tray appropriately. So my advice is don't bother with sublingual bars. So anyway, you can see that it's really quite low here. She's got that recession on the back of that tooth there. We've kept all of this as far away as possible, all as open as possible, keeping Saeed as happy as he possibly can be, so that the saliva can get in there and the patient can get their TPs through, even with the denture in place. So, and if we look at the front on view here, so you can see that's the gingivally approaching clasp here, there. And, you know, if we're going to have sorry, that's an occlusally approaching clasp, but if we had a gingivally eye bar like that, that flange would have to be thicker because it's sitting over a root. So making it really chunky is it's not going to sit flush over that area nicely. Let's have a look at the back tooth here. Can you see that lovely gold clasp that Rowan's done? It's quite gentle on that tooth there. And I love the thing about gold is, and also stainless steel, I can adjust it chair side easily without worrying about it snapping. You know, with chrome, I'm always a little bit worried that it might break. And also, I find that with chrome, I can actually warp the actual chrome rest seat where it comes off the top there, and sometimes the fit of it isn't as good. So I love these. These are great. So worked really nicely with this lady. Interestingly, we made her an upper metal based like that because that's what I like to do for patients that have combination syndrome, as in natural low teeth biting onto a full upper. But she really, even though we'd done all the video trying and that, when she got home, she hated this upper denture for quite a few reasons. One was her speech was slightly different. Also, she felt she showed too much gum, and her speech was really, really affected by the metal base and the thickness of it. So what we did was I said to her, look, okay, you know, you're not going to get used to this upper. We're going to have to just start again. So what I did was I made her 2 acrylic based dentures rather than 1 metal based one, because what I found is with just acrylic based dentures is that patients tend to crack them, over time, because they're so comfortable. The ones that Rowan makes, the patient can really chew really well, and then a few years in, they get a crack in the midline. So if I've made them 2 sets, they can wear one on a Monday and then one on a Tuesday and swap it. And then when one goes catastrophically, they can bring it straight to Rowan. He can repair it. And they've also got one that they're used to wearing comfortably. And it works really well. I'll just show you what I did for her, how it looked. It didn't take long for us to make another, two lots for her. I did Gothic arch for her. So yeah, these are the duplicates. You can see there, we've got the 2 tri-ends like that. And these were much lighter as well. We measured them in terms of weight. The one with the metal basing was 25 grams, and the one with the acrylic base was 14. And she actually felt that there's a little bit of a difference there too. But I'll show you her finished product. She was just much happier with that aesthetic as well, where we'd lifted the teeth and also brought them out just a little bit at the top there. So fine. I just wanted to share with you a couple of things on that from the running forwards from that. So the composite rest seats are very, I think, really, really important, these additive rests. So if I just go back to her slide with the there, you can see on this model there, can you see those little composites there? Stuart, can you see them all right on that?
Yes, yes.
So, so these are, I just add those by just by sandblasting and etching freehand, exactly. There, and then inside the fitting surface of the metal framework, we've got these little bits there, and they fit beautifully on those there, and it just saves me from having to prep into those teeth. So if I look at slide 256 here for you,
you ask for a spacer over it when they mold the chrome?
No, they're just the chrome's fitted directly to them. It's
direct then.
Absolutely. So if we had any space on it, wouldn't engage then anymore.
Yeah,
so,
of course.
And also I don't like them to polish that surface. We leave it unpolished. And if I have to adjust it when I'm fitting it, I sandblast it.
Right.
Just with the intraoral sandblaster. And then you get this nice sort of fit. You can almost feel it on the teeth.
You sandblast the crown, you mean?
Yeah, sandblast the
Not the
fitting
composite.
surface.
Yeah.
So wherever it sits against the soft tissue, like here, the sublingual bar, that's highly polished underneath. Yeah. So that's that there for you. So I just wanted to show you on the slide composites 407. So, you know, these like that, those sort of things, composite rest seats are what I routinely do, just additive. So it just goes onto the tooth like this, and then the metalwork can just fit over, and it just prevents, you know, distalization and sinking of the denture itself. So the other bit, which I think is quite important, with this lady, Janet, she had a ring on that back tooth. So if she happened to lose that back tooth, because we know that the prognosis for that back tooth is dubious, then I can add to it. And I'm just going to find that for you. Slide 25. Just bear with me. Lovely. Here we go. So I made this denture for this patient, and she lost that tooth there, that lower left tooth. You can see that that's where I've extracted it. And in those circumstances, I can just do like a little, just modify the saddle with some compound, and then add some adhesive, and then I've done a little Imprigum impression there. It could be zinc oxide, something like that's perfect. Then a pickup, and then Rowan just adds on to that denture there like that. And then this is, you know, the patient can then wear that, you know, for many years. In this case, in fact, Brian, it might be one of your cases. It's definitely from across the road. This lady, I sanded that away afterwards. Can you see how the ring sticks into the mouth there, where the natural tooth used to be? I actually cut that away, so it's just nice and smooth on that edge, and sort of narrower on that. So that's that. And then the other thing is, with this particular patient that I've just done the design for, we did those metal backings on those lower anterior teeth because I was unsure about the prognosis of those teeth. If those teeth were really healthy and I knew that they were going to last with good normal care, then I wouldn't put backings on them. I'd do it like this. I'll just show you. Nice to see you, Zoe. Are you okay?
Hey Finn, yeah, sorry, I was just putting the little one down, so I was a bit late joining.
Not a problem. It's fine. It's great you're here. So let's have a little look. 374. So for instance, here, this lower, ignore the upper there. If these lower front teeth there are in good nick, then I don't bring the metalwork on because it's compromising those teeth. But what I do like to do is to extend it onto, actually, to be honest, in this case here, this patient, that was
we can't see your screen.
Oh, sorry. Thanks for telling me. I've not shared my screen. That's great. There we go. There we are. So you can see that now. I can see it there too on my little comfort monitor. So here we've got this is, if we've got really good lower anterior teeth there, then I don't extend the dental bar on those bits. But in this particular case, this patient had a crown on that tooth on the 4s. So so therefore, that because there's a crown on that, I don't know how long that tooth is going to last. So I want to be able to add to the denture if necessary. Now the canine's in really good condition, so I add a good positive rest on that there. So, and then, so the actual denture itself, the finished denture looks like this there. So we've got a nice ring on that there, and I've used my gold clasp on the premolars this time in the middle of the denture there. I've not clasped that back tooth, so my 2 clasps per denture are on the 2 premolars. And if we look at that in the mouth here, we've got that 1 clasp on that crowned premolar there, but we know that this is that canine, she's really unlikely to lose it. And I've got that, it rests on the back edge of that tooth there. So should that tooth go, we can add a tooth onto it there, and then we can bring a gold clasp. And even what we do is we quite often salvage the gold clasp. Rowan will cut out the existing one, add on the tooth, and then bring the existing gold clasp and fit it around that new tooth at the front there. And these are the gingerly approaching clasps that I really like on those. And you can see that ring rest at the back there with no clasp on it there at all.
And can I just ask?
Yeah, go for it.
If we were to have that case, and you've just said try and avoid a sublingual bar,
yeah,
would you just go back to the original rest seat and plate a lingual plate?
I would do I'd still do a bar. I'd do separate dental bar and also a lingual bar, but I'd have to come further towards the gingival margins on the teeth there. So it would be a bit of a compromise on that.
Yeah,
definitely. Yeah.
Yeah.
So, sometimes the Scandinavian rules are that you keep more than 3 millimeters away from the gingival margins of the teeth, from not from the tooth side, because that can be like a resin bonded bridge, but from the gingival side. So we keep 3 millimeters away from the margin below. But sometimes we've got to come up closer and break the rule, unfortunately, because we don't live in a perfect world with that sort of thing. So, yeah, good, fine. So that's that. I'm going to just show you the next case is another lower free end saddle one, and it's this one here. There. So can you see that there? No, I haven't shared my screen yet. I don't think, have I? No. There we go. So this is Anne. Treated Anne years ago, actually, and I've already made her a partial a number of years ago, and the one that we made, you can see, has done a bit of damage here. That she came about 10 years ago with these lower anterior teeth there. These are my original composite rest seats, and it was in my early days of using the Scandinavian design, and I just the actual existing denture was just a little bit too close. You can see it here. It's not. It's actually covering the back edge of that tooth there. So, and also what the patient had done was she actually was wearing an old upper denture, the one that I'd made, which is an acrylic one, which was this one here, had split. She got a little crack in it, so she'd resorted back to her old original upper denture, which had a dipping occlusal plane on it. So I might have some photos further down here of it. There it is. So she was wearing this again, which had a really dipping posterior occlusal plane, but biting against the lower denture that I'd made. So as a consequence, dipping occlusal and biting on the saddles of that lower, and it's been pivoting, rotating into the back of those lower front teeth. So anyway, it was time for us to make a new one. So let's have a look at what I do for her. So that's there. We've got these nice little composite rest seats on just there. So I will now I'm just going to show you my approach to this for So here we go. So again, it's just, now we've got on the upper arch, we've got the full upper denture, which is upper 6 to 6. So I'm going to just replace just the lower posterior teeth back to the 6 and no further back. So draw in and here, and she's just got those lower 2 to 2. Interestingly, this patient, she has porcelain upper teeth on her denture, just on the upper 3 to 3. She wanted ceramic upper teeth, and they're much harder to get hold of nowadays. But what she liked was when she was biting together the ceramic, she liked the feel of the porcelain biting onto her natural lower teeth, that sort of sound, rather than it being a dullish sound with acrylic. So we've got these here, so replacing those. And then next, what I'm thinking about is saddle design. So I want to maximize the extension, all the way back. Certainly, I want to go halfway up the retromolar pad, both sides. Full dentures, fully over the retromolar pad. Partial dentures, halfway up the retromolar pad. So I swing it all the way back, and then coming in really tight up against that tooth there, so we're not getting that superfluous bit of pink here and here. So, and then we've got our composite rest seats already on these teeth, and because we've got that recession, I really thought a sublingual bar was right for her, and so that's what actually I have done for her. In this case, we've taken it right down underneath the tongue to try and avoid these issues of recession on these back teeth there. So, and then it's just a matter of colouring in, and 2 clasps per denture. So on these the lower for her, I'd already done eye bars, gold eye bars in the past, so that's what I went for her. So nice gold eye bar there. And actually, when I do a clasp on a denture, I like to indicate that we've got retention on that with an X. It's something that Charlotte Stilwell does, and I just like it. It just helps to indicate we've got some retention on that too. So, and then I just, colour all that in there like that. So, any questions about that design or this case? No, that's fine. So I'm going to share my screen, so I'll show you what we did. She got on really well with the sublingual bar. In fact, that was my design that I'd done for her. And then we've got ceramic porcelain teeth. Her existing denture, which we made 10 years ago, had split. So we replaced, we did a metal base. And also the other thing she didn't like with her existing denture was that it was darker. The teeth we put on it was slightly darker than her original denture. So, and that was another reason why she liked her old one more. Once this had split, she was like, oh, I want them lighter too. So let's just go further down. That's the metal framework try-in here with these gold gingerly approaching clasps. These are soldered on. If you look really closely at the screen, in fact, I'm just going to go close in there. And this is interesting, just what you were talking about, Stuart. Can you see that blob of composite on there?
Yes. Yeah.
These are what I put on 10 years ago to help retain the existing, the original denture. So, so that's the sort of thing we'll look at when we've done our first primary impression. We do that. I have a good look at that, and Rowan helps me with that. But can you see how with the sublingual bar, we can get really quite deep with it there, just keeping it away from those gingival margins. But as I said, they are really, really technique sensitive. So, and the technician's got to be awesome at making the chrome as well. So I really would avoid doing those. There's the metal base there. You see the the chrome there, nicely extended. We've captured all the retromolar pads on this denture. Gothic arch tracing as usual, and I'll show you that the denture there. So you can see it's nicely extended right the way up the retromolar pads. Look at that horrible recession. You'll be horrified, Saeed. There. Hopefully we're going to keep those teeth for longer. Now she can get a TP in there with the denture in place. So there we go. That's it with it fitted there, and you can see that metal backing just there on that in place. And I saw Anne here. I did one review for her. So these are ceramic teeth. These are Candulor upper. They are porcelain teeth at the top for her. Let's have a look, see whether you can see the, so we've got nice, we're keeping it away from this danger area. That recession is still right down there. So the 3mm rule is broken, but I can't get any more space down there with that. So that was her existing denture. You can see that, the original, very original one that she had, which was, often the teeth are just set on the ridge and too far back and down. And so we've brought ours further out. Out and up is the general thing. If I look at the side view of the denture that Rowan made, there, they have a different shape to them. The teeth are brought further out and up. So there. So fine. Okay, it's 20 past. One more case and then we're done. So what would you like to have? I'll give you a choice. You've got a choice here. So we've got a choice of upper bilateral freehand saddle or upper unilateral freehand saddle. Which is the most scary for you?
Bilateral.
Bilateral, okay. Fine. Actually, the unilateral is more scary for me, to be honest. But because anyway, it's fine. Let's go for it.
Well, go with the unilateral. I've happily learn on either. So
no, I think the bilateral is better for in general practice. You're sort of dead scared of freehand saddles. I think of unilateral upper with upper anterior teeth. So we can do this other one at another study club. I'll do the unilateral at another study club. So let's go for it. And this is actually a joint case that I've seen with Saeed and also with Rob as well. So sorry, I'll just share my screen. I've not done it again. Sorry. There we go. So this is the case here. Now, this lady, Mary, she had she's been on bisphosphonates for a long time and was really, really worried about extractions. She was on, and a doctor had advised against it. So this is how she presented. She's got these upper 5 anterior teeth. Steve Barber had done a bit of composite work years ago. It was like years and years ago. He'd treated her and just put these composite veneers on freehand. But there was this swelling here, and it was this central tooth that was an issue. So just there. And I'm going to show you the x-ray pictures of that. And this was really wobbly. It was I'd say it was grade 3. Would you, Saeed, when we first saw her?
Thank you.
Yeah, definitely agree. It's quite very mobile.
So, and Steve had made of this denture, which was an acrylic based upper. And this is the issue with acrylic dentures. I think that acrylic dentures are just temporary devices. It was a great denture when it was fitted, but it's a gum stripper at the end of the day. And you can see it's sinking in. It's damaging. It's not great. So let's look at the x-ray. That's the upper denture, nicely extended, the one that Stephen made, but it's not supported by these lovely teeth at the front there to stop it from sinking in. So this was the x-ray picture of that upper anterior tooth there that's really wobbly. She doesn't want to have that extracted. So we did, Rob did some endodontics on it, and that immediately sorted out that swelling. And then Saeed's done some surgical. Have you done surgery on that, Saeed?
I've done non-surgical. She's coming in about 3 weeks for a last bit of surgery on it. It's actually firmed up quite a lot, actually, surprisingly.
It has, yeah. It's in much better nick. So, in terms of design for this, I will show you. I'll just quickly show you what I'm thinking about. Now, I'm always looking at smile lines, particularly at the upper, and she shows loads of tooth at the top there. And I know that her teeth aren't particularly nice to look at, but she's hiding that there. So I want to avoid metal clasps on this. When someone's got a really high smile line, I want to avoid metal clasps. Plus that the dental D can help disguise some of the problems with the necks of these teeth too. So that's just the first thing to think about. But let's have a look at the upper there. So if you just visualize this now, so we've got these teeth here present. In the lower, what I'm thinking is, how many lower teeth has she got? So basically lower 6 to 6, really. That's there. So if I'm going to make a denture opposing that, I'm just going to have upper 6 to 6 on the upper denture too. So now I'm going to stop sharing and I'm just going to do this dead quick. So we've got this is the upper. Now we have I'm just going to replace those teeth there, and then we've got round to the canine on the other side like that. So that's what I'm thinking is upper 6 to 6, lower 6 to 6. If she had lower 7s and further back, I'd put 7s on it. Right, next. So I'm thinking about my saddles. So we're going to come really, I don't want any pink coming out here, coming back here like that, extending round the back of the tuberosity. This is what I'm thinking about all the time. I'm coming right the way back. I'm going to swing it further forward and do a little chink like that. The nasopalatine, the actual palatal bone is shaped like that. And I just think it looks nice to finish the denture like that at the back there. and then come back round here like that, and then tuck it right in nicely like that there for that tooth. So now anteriorly here, I'm going to use those teeth for support. But with uppers, I don't want to do additive rest seats on because it often jacks the bite open, you know, because I'm putting a backing on anyway. So the patient will be occluding onto that backing. If I put composite on the tooth, as well as my backing, it's really going to jack them open, and it's going to make their speech an issue. You know, palatal backings on uppers can be an issue. So subtractive rest seats on uppers is my general rule here. So, and I'll cut into those teeth there. And also, you know, that tooth that's really wobbly there, that Rob's root filled, I can do a really good dimple in that. And that dimple is going to go into the tooth and help hold it, lock it in place, stop it from bouncing forward too. So that's quite useful, that. So, and then these are my metal backings. Now, I want to keep away from the gingival margins at the front here. So I'm going to swing forward all the way around like this, like that there. And then my metal and acrylic junction is like that. And then the final thing that I've got to think about is clasping. So dental Ds here are going to do the trick. You know, these acetyl resin clasps are really, they're really good. They're not brilliant aesthetically, but they're better than metal. So there and there. And then I can just colour all that in, you know, the metalwork on the back here like that. Colour it all in. There. And I'd label all that up, you know, like saying, right, acetyl, dental D clasp. And then the other, this is really important. We've got great support from the palate. So this palatal strap here can be nice and thin, but it's broad and it gets great support from the palate, you know, which is really important in these cases. So I will share with you what I did. And it's worked a real treat. It's been lovely. So special tray, that's my impression, you know, with compound there. Definitive impression in alginate. This is my jaw registration using a Duralay try-in. If we look at the, can you see I've done my rest seat preps on there now nicely, you know, really cut in. And that's my jaw reg, face bow transfer all the way through to just doing the try-in, just checking the metal base fits nicely. This is with no clasps on it, the metal base. Tooth try-in, making sure that the patient's happy, you know, with those aesthetics there. I did a little bit of tidying up of the composites too, you know, just smoothed them off, just made them look better. I think Zoe, you could really go to town for Mary in the future if she wanted to.
I don't know, Fen, you done a good job there.
No, I think you could do it. You could make it look superb. So that's the finished denture there. You can see how it all, we've got this lovely metal backing. We've got these acetyl resin clasps on the denture, fully extended around the tuberosities. Let's have a look from the side, from the front there. Can you see those? These are these injectable clasps, and these are fitted. These are actually processed on after the denture has been finished in a little channel. They're cut in to the denture. We've got a little injection molding machine to do that. The practice there, you can see. So, in fact, that's the material we use. It's actually a Argentinian product. That's the flexible acetyl resin stuff. So, and then you can also see where I've done those dimples to really get into those, you know, that central, this is that central incisor that's super wobbly. So it just sticks right into that there too. Oh, there's a freehand saddle there, Stuart. It's crept into my photos for some reason. There.
Yeah.
So, but this is it here fitted there. So we've got that, you know, nicely round there, and in place, just tidied up. And look at that. This is looking so much better, isn't it, than when we first started? You know how red and swollen that area was. She's coming back in to see Saeed because this sinus has just opened up again, actually, recently. She just got back in touch with us this week. So Saeed's going to do a bit of surgery on that. That's it there, all fitting. And she's a really lovely patient and she's coped beautifully with this. You know, the whole thing there. And it was just one review that we needed for her, you know, so you can see there that and actually the nice thing about the acetyl resin, it can just come round and just cover that and disguise that little bit of recession there on that tooth. Fine. It's 2 minutes past 1/2 Study club finished. So have you got any questions though at all about what we talked about tonight?
Just when you cut the resi into the crown on the upper lateral,
Yep.
does it bother you if you cut through the metal down to tooth or the core? Because
no,
of the depth
no,
you need to cut.
actually, no, it doesn't. I know this is, you know, some dentists will be really horrified about this, but I do perforate crowns quite regularly for this purpose. And it's a bit like, how often do we see crowns that have got a little perforation in? Is there a problem?
No. Or would you
No.
suggest replacing the crown if the patient was bothered by it?
Definitely, absolutely. And it's all a question of cost, isn't it, really?
Yeah.
So I always talk about it with the patient, though, and say, look, we're going to drill through and it might make a little hole in the back of the tooth. I don't think it will be a problem for the tooth, but if you don't want me to do it, I won't do it. But the denture won't fit as well. You know, it may drop down, move around more.
Yeah.
So that's why.
Give them the choice.
Yeah, give them the choice. Yeah, absolutely. So yeah. And that's it. Yeah. So if the tooth is lost in the future, though, we just weld a little tag on,
Yeah.
you know, to the backing, and then the tooth's added on. It does mean that the patient needs to be without the denture for about 5 days, actually, unfortunately, when that's the case, because it has to go to Chris and then Rowan adds onto it. But it means they're not having to have a new denture made.
Yeah.
Cool.
Thank you.
Brilliant. All right. So we're going to have a break next month for the summer, and then we'll start up again in September. And then in October, we really would like to have an open night, a proper open night with people there. And we can all chat in person. So thank you very much. Right, is there anything you wanted to say, or
And you
so
broke
or
up quite a lot
Saeed?
there.